The past few years have had a substantial strain on America's healthcare system. Some of the biggest relief providers to this system are community health centers. To date, these centers have provided a combined 42 million COVID-19 tests and vaccines to underserved communities across the nation.
Community health centers were born out of the civil rights and social justice movements of the 1960s. By 1975, thanks to Senator Ted Kennedy, who championed legislation and Congress to provide funding for community health centers under the U.S. Public Health Service Act, Section 330, provided funds for community health centers to provide care to the medically underserved and uninsured population of the U.S. In 1990, Congress, under Section 1905, created community health center lookalikes. That allowed other centers, such as ours, to continue to grow and be able to expand to provide care to the medically uninsured and indigent. That action also didn't provide funding. So basically, here we are serving the community without any federal support. Currently, there's over 125 lookalikes across this nation, all doing what funded centers do. And we're constantly looking at Congress to appropriate dollars for us to provide more care, more services to the medically needy and underserved population.
The community health centers are very important because we are able to identify patients that need treatment for their chronic conditions, which if they don't have access to our community clinics, they will not be treated for their chronic conditions. We are very passionate to help these people that they don't have insurance. We don't treat them based on their economic or financial status. A lot of the population, they're not even aware that we offer these services. We also have a sliding scale program that have a very low cost for the office visit. And once the patients, they're aware of all the services we provide at the community clinic, they're able to go and spread the word in the community, and they feel that they are being heard and they are being treated.
So we're working on how we can, again, face these challenges of getting our patients to come in to receive what we call preventative care and routine care. It's so important. Part of it is how do we make sure our patients have the insurance plans that they know they can come in and receive their services and receive regular care with their providers. We have been working at the national level so we can receive funding for the community health center. And those funds will allow us in different areas that we can improve our services. One is going to be recruitment of critical staff that we need. That funding will help alleviate some of the challenges we have when it comes to recruitment of physicians and our critical staff. The other part of it, again, the funding that would have will allow us to be able to bring in best practices of medical services to our community.
Unlike federally funded community healthcare centers, lookalikes like these have a tougher time lobbying for funds that are crucial to ensuring marginalized and vulnerable populations have access to healthcare.
I was at one point an underserved patient, and that's what motivated me at one point to become a physician assistant. And I'm very passionate to help the underserved farm worker community because I understand the great need that they have, and also to identify those conditions that they have that sometimes they're even afraid to go and seek medical care for chronic conditions because the funding source is not there. We need to gain their trust in order for them to take those medications, and also the health education that they need to eat better foods, to avoid obesity, and also take that message back to their families, their friends, to have a better outcome overall in health.
When we were established, we were designated as a federally qualified lookalike center. Basically, what that means, we don't get funding. However, our services are not compromised in any way at all because the standards we provide are equal standards as any funded center throughout the United States. We are required of all the 93 elements that a center has to comply with. We make sure that we're providing to the federal government UDS data, which is going to be quality metrics. Our program looks at trends, we look at data. So we report data to our providers so we can look at trends. And those trends could be looking at how we have to change workflow. And we'll make workflow changes as needed to ensure that we're providing the highest quality of care for our patients.
Funded 330 community health centers receive annually about $5.8 billion in federal support. But it's also been demonstrated that in a course of a year, they've been able to save the Medicaid and Medicare system over $25 billion by treating patients early in their ailments, having them come in, be treated, and stay out of the hospital. Even though we're seeing the most vulnerable population, patients can come in and be able to save the nation dollars for the small investment that they make in community health centers.
To ensure Castle Family Health Centers, along with the thousands of other community healthcare centers across the country, can continue serving their 30 million current patients, consistent funding needs to be made a priority on a federal level.
Community health centers such as ours continue to educate Congress about the need of the financial support to be able to meet the needs of our patients and the services we provide. It is very important that the lookalikes, especially the 125 across the nation, get subsidies, some sort of subsidy to be able to continue the mission that we've all set upon. We've been able to demonstrate that we can improve the healthcare of the community, done at a lesser dollar, and the volume speaks for itself. So we hope that the citizens, the nation, and those that empower organizations like ours, they continue to fund and they continue to support our mission to be able to be here for the long run.
For more information, visit cfhc.care.